Christina Checki, and I chose my topic for this assignment to do it on obesity, PCOS, and infertility. So the question that I have is, does obesity play a part in PCOS and infertility? This is relevant for me because I actually suffer from PCOS. I was diagnosed my senior year of high school and had to have surgery. So this information is important because more and more women are being diagnosed with infertility and PCOS. And this information would help doctors understand the cause of PCOS more and how obesity can have an effect on that and just people's body mass index. So a non-reliable source of information would be someone from TikTok or Instagram saying that they know about this subject, but they don't really because they haven't done full research on it or did any studies. The article that I chose to do the summary on was hormonal imbalance in women with infertility caused by PCOS. Is there a connection with body mass index? So the introduction is infertility is a growing concern in socioeconomic populations. There are many factors that can cause infertility, such as ovulatory disorders, endometriosis, and the most common cause of infertility is PCOS. The main pathopsychological components are gonadotrophic dysfunction and insulin resistance. 60 to 80% of PCOS patients suffer from obesity. Obesity is the main recognized cause of menstrual and ovarian disorders. The aim of the study is to define reproductive hormone levels in women and with infertility due to PCOS, depending on their body mass index. So the subjects and methods. So the researchers did this study on 100 women who between the ages of 25 to 39 with infertility due to PCOS. And then there was 30 women between the ages of 25 through 39 with infertility due to tubal-peritoneal causes. Those were the control group. The study was conducted at the clinic of Professor Stephen Camille Medical Center in 2015 through 2019. And so infertility due to women with PCOS was diagnosed by accordance to the Rotterdam criteria. And then infertility due to tubal-peritoneal was diagnosed by laparoscopy. So the method that they did was they got the height and body weight of those who were there, and then they also did some tests on their blood and their hormone levels. So the results were the women with PCOS had levels of antimalarial and other hormones were elevated more than the control group. And then the FHS was reduced. LH and FSH ratio was higher in PCOS women. 42 patients had normal weight, and then 58 of them were overweight. There was a direct correlation between BMI and sex hormone levels. PCOS is more frequent in obese and overweight patients. Decreased levels of FHS was more important when comparing the two. Prolactin in blood was higher with patients who had PCOS and obese. And then the testosterone levels were higher in PCOS and obese patients. The BMI had a inverse correlation with the hormones. So the discussion part of it was obesity causes PCOS in women. 42% of patients with PCOS had normal weight. Obesity is not the only factor to PCOS. There are other factors that contribute to it, but if you are obese, there is a higher chance that you will have PCOS. And it's a higher risk of you'll have infertility. AMH levels were increased with PCOS. AMH is basically a glycoprotein that is synthesized by the granular cells of small antral and perinatal ovarian follicles. It is probably due to a number of small antral follicles in PCOS. And then the conclusion is there's a hormonal imbalance with women who have PCOS. And then there's a weak inverse relationship between BMI concentration and reproductive hormones. Obesity makes the hormonal imbalance worse in PCOS.